all to better understand how the cost of war influences funding levels across the board in our federal budget. The goal of tonight's study session is to provide the community with the information necessary to really evaluate the President's proposed budget and form educated opinions on the budget that Congress is in the process of putting forward. The federal budget involves funding for all of our nation's programs and services. It's a clear reflection of our nation's priorities. Our daily lives are impacted by the choices made in the federal budget. And as we're once again in the congressional budget process, we have the opportunity to make sure that the priorities of American families, the priorities of the working people in our country, the priorities of our children and seniors, the priorities of all of us here today are in the budget. It's impossible to ignore the fact that the war is taking a real toll on this nation, beyond the toll being taken on the lives of the Iraqis and Americans directly affected by the war. War costs money, and somehow we've been financing the war. Now the President wants even more money at the same time that he's saying we cannot afford to spend money on health care, education, and other domestic programs. There's a national movement to demand that the congressional budget process reflects the priorities and the needs of the people. And on this 4th anniversary of the war in Iraq, organizations around the country are holding events to talk about the budget process with the goal of empowering people to speak out to Congress and demand that our priorities are met. So thank you everyone for coming here tonight to learn more about the budget process and how the cost of war affects the budget. I hope everyone has signed in. If you haven't, please sign in on the way out. That's how we can keep in touch with you. And I hope everyone has an agenda for tonight. We're going to start by having a brief overview of the budget process, and then we'll take some time for an economic analysis of the war costs, and then we'll review how the war has impacted veterans' health care needs. Then we'll examine how the cost of the war influences health care funding, and after these presentations we'll have a chance for some discussion and question and answers, and then we'll end by information on how citizens can participate in the budget process. So please allow me to introduce our first speaker, Aurora Arias, who's an intern at Champaign County Healthcare Consumers, and Aurora will be providing a brief overview of the budget process.
From the university at Champaign County Healthcare Consumers. Tonight I will be talking about the congressional budget process. I'll also talk about the President's budget request for the 2008 fiscal year, including his major spending and funding proposals. Lastly, I'll tell you about the current status of the congressional budget. The congressional budget is our federal budget, and it serves two important functions. The first is to provide a financial measure of federal expenditures, receipts, deficits, and debt, which are basically our country's overall finances. The second is to provide means for the federal government to collect and allocate resources to meet national objectives. The federal budget embodies what Congress perceives our nation's goals to be for the upcoming year. Where Congress makes the choices to allocate our money shows us where their priorities lie. It is important for all citizens to understand the budget process because it affects our daily lives. The congressional budget process is made up of several intricate steps. According to the U.S. Constitution, there is no specific procedure for creating the federal budget, which of course results in a time-consuming and confusing process. The Constitution also states that it is Congress who has the power to spend our money, not necessarily the President, as many people think. The first step in the budget process is the submission of the President's budget request. His request is very detailed and contains supporting documentation and suggestions for the funding of all federal programs. The second step is the Congressional Budget Resolution. Although the President submits his own budget request to Congress, Congress holds its own hearings and creates their own separate budget resolution. The House and Senate budget committees make the first draft of the Congressional Budget Resolution. This budget resolution will include budget totals and spending by budget function. Basically, the objective of the budget resolution is to first determine the overall size of the fiscal pie and then the particular size of the various pieces. After the House and Senate budget committees agree on a budget resolution, they will submit it to the House and Senate floor where it can be amended by a majority vote. This can be very extensive and complex. After a House-Senate conference committee resolves all the differences, both houses pass a conference report. This process should be completed by April 15th, but often takes much longer. The next step is to make annual appropriations. Appropriations are funding levels that are determined for each category necessary. The House and Senate Appropriations Committees are organized into subcommittees such as Defense, Education, Agriculture, and Homeland Security. Each subcommittee is in charge of creating an appropriation bill for their assigned function. The House and Senate Appropriations Committees will then subdivide the amounts given to them in the Congressional Budget Resolution. There are two types of spending in the federal budget, mandatory and discretionary. Mandatory spending includes the spending required by a binding legal obligation, such as Social Security or Medicare. In essence, mandatory spending is automatic spending. However, there are always exceptions, and some mandatory spending might require an annual appropriation to establish the annual funding level. Therefore, this funding is not automatic. Discretionary spending requires annual funding decisions to be made in the appropriations process. The federal budget is divided into several categories. The chart you see here is the President's proposed budget for the 2008 fiscal year. It includes the following sections. Human Resources, which is 32% of the total budget, and includes the Education and Labor Departments. General Government, which is 12% of the total budget, and includes the State Department and NASA. Physical Resources, which is 5% of the budget, and includes Transportation and Commerce. Past Military, which is 20% of the budget, and includes Veterans Benefits. And lastly, Current Military, which is 31% of the total budget and includes Research Development and the Department of Defense. As you can see, the President's proposal includes expenditures that have 49% of the budget as non-military funds and 51% as military funds. Therefore, the cost of the war and military spending really does have an impact on our national budget. Now I'd like to talk a little in detail about the President's budget proposal. The President's budget request includes three major spending proposals. The first is to increase defense spending by 11% to $461 billion, in addition to $93 billion supplemental funds for 2007 and $142 billion for 2008 to fund the war on terror, which includes Iraq and Afghanistan. The second is to cut Medicare and Medicaid spending by $101 billion over 5 years and impose higher premiums on some Medicare beneficiaries in Medicare Part D. His third proposal is to hold the growth rate of non-security discretionary spending at 1%, which is well below the 2.5% rate of inflation. The President's budget request also includes three major revenue proposals, which are to make the tax cuts slated to expire in 2010 permanent, to provide new standard deduction for health insurance while removing virtually all other health care cost tax incentives, and lastly, to renew the higher alternative minimum tax exemptions through the 2007 tax year. Now I'm going to tell you about the current status of the budget process. On February 5th of 2007, the President submitted his budget request, which I just reviewed the highlights of. Since then, the House and Senate budget committees have created their own budget resolution. Right now, the budget resolution is slated to go to the House and Senate floor for vote during the week of March 26th. Details of what is included in the budget resolution are forthcoming, but I can tell you that positive announcements have already been made. For example, House Speaker Nancy Pelosi announced Friday that the House budget resolution will include a reserve fund to cover all children who are eligible for the State Children's Health Insurance Program, SCHIP, a step that, if approved by Congress, would lower the number of uninsured children by millions over the next 5 years. In fact, next Thursday, the House will vote on a supplemental bill for the 2007 budget that will provide SCHIP funding for states that have a shortfall. From that bill, here in Illinois, we would receive over $200 million in SCHIP funding. Later in the agenda, we will learn more about how we can be involved in the budget process. If you are interested in learning more about the congressional budget process, please refer to your handout for more detailed information. Thank you.
Thank you, Aurora. I did not know that much about the congressional budget when we started this, so I appreciate it. And I realized I forgot to introduce myself when I started tonight. My name is Katie Coombs, and I am on staff at Champaign County Healthcare Consumers, and we're delighted to be sponsoring this event. So I'll move on to our next speaker. We're going to hear from Senior Policy Analyst and National Coordinator at Just Foreign Policy, Robert Naiman. Bob will provide us with an economic analysis of the cost of the war to help us understand what we're giving up as we continue to fund the war.
Thanks, Katie. Excuse me. I was told to project, so I want to thank Katie and Allison Healthcare Consumers for setting up this event. I hope you won't think it's a conflict of interest if I thank the Elmo Disciples Foundation, even though I'm a board member, for providing the space for us to have this event. Obviously, it's important that we try to understand what the cost of the Iraq War is in the United States, what the economic cost is, because as terrible and as important as the loss of life and terrible injuries from the war, if we focus only on these things, then we understate the cost, even to our own society, without even considering the cost to the Iraqis or others in the Middle East. And if we understate the cost, then we don't fully understand the consequences of the choices that we're making or the choices that are being made on our behalf. And this obviously has implications for the future because although we obviously can't undo the decision to go to war in Iraq, we could end the war sooner rather than later, and we could also avoid other wars like the war that some in Washington are trying to, very much like to launch on Iran. The task of understanding the cost of the war is made more difficult by several things. First of all, there's been a deliberate effort to obscure the cost of the war by the Bush administration. Bush administration officials have largely, almost exclusively, financed the war through supplemental appropriations outside the regular budget process. These appropriations, they have to provide less detail and they're subject to less scrutiny. And they've also tended to lump some funding for the war together with funding for the war in Afghanistan and the so-called global war on terror. Whatever one may think of these expenditures, and I suspect that many people here are also opposed to these expenditures, the decision to go to war in Iraq and to continue that war is a distinct choice, and we have a right and obligation to know what the cost of that choice is, distinct from other costs. Second problem is that assuming that we can get accurate numbers separate for Iraq, there are different ways of measuring cost. The principal variation that one sees in estimates of the cost of the Iraq War is between estimates of the cost of appropriations that have been approved by Congress to date and estimates of the overall cost of the war, including future costs for which Congress has not yet made an appropriation. For example, what Joe will talk about, the future cost of caring for injured veterans. That's not, Congress hasn't appropriated money for that. Congress will have to appropriate money for it in the future, but it's a cost that's we've already made the choice. Those soldiers have already been injured, and we're already obligated to care for them, some of them for the rest of their lives. Their injuries are so grievous, and so that's a cost that we will bear for decades to come in the future. The National Priorities Project estimates that Congress has appropriated or will appropriate $456 billion for the war in Iraq by the end of the current fiscal year in September 2007. This is including the President's current request for about $100 billion in funding for the Iraq War. Contrast a study by Linda Billmans, if I'm pronouncing her name correctly, and Joe Stiglitz estimated that the real price of the Iraq War, when you add up the spending to date, future costs, and economic impacts such as higher oil prices, is well over $2 trillion. And that's including their estimate of the future costs of providing medical care and disability benefits to veterans, which they estimate somewhere between $300 billion and $700 billion. Finally, perhaps this is the largest problem, for most people these numbers are essentially meaningless. Right? So we have nothing to compare them to in our daily lives. We don't deal with $300 billion in our daily life. So $456 billion, $2 trillion, these are basically the same. They're just really, really big numbers. So in order to understand what we're giving up to continue the war, we can compare these costs to what we could achieve if we spent the same money on domestic needs. The National Priorities Project gives many examples on their website, and I will just give one of them, which I'm going to adapt a little bit in the hope of making it even more accessible. They estimate, based on our share of federal taxes, that in the Illinois 15th Congressional District, we'll pay roughly $1 billion for the Iraq War through the end of this fiscal year. So that's our share based on our share of federal income taxes of that $456 billion figure. Now there's roughly, according to the census, there's roughly 150,000 children under the age of 18 in the 15th Congressional District. With this $1 billion, we could have provided health care for every child in the 15th Congressional District for the last 4 years. And this is, now we're not talking about just poor children, we're talking about every child in the 15th Congressional District we could have paid for that. And these numbers hold nationally, so in the last 4 years, as the war is now 4 years old, we could have provided health care to all children in the United States, not just poor children, but all children in the United States. If we restrict our attention just to children who live in poverty as officially defined, this number for the 15th Congressional District is roughly 15%. According to the census, roughly 15% of the children in the 15th Congressional District live in poverty. So roughly speaking, we could have provided health care for these children for 27 years, based on the, this is just based on the cost of the Iraq War so far, not, or including the end of this fiscal year, not what lies ahead of us, which in any scenario, substantially more costs than we're facing. So I would suggest that this is the context in which we should view the question of the cost of the war. Some may wish to say that we cannot afford this war. Sometimes you hear people say that, but that's not really true in an economic sense. The economic cost of the war in inflation-adjusted terms is somewhere between the cost of the Korean War and the Vietnam War, rapidly approaching the cost of the Vietnam War. And certainly, in the future, will exceed the cost of the Vietnam War. But the economy has grown substantially since Korea and Vietnam, so as a share of our national income, as a share of our national economy, which is ultimately what determines our ability to sustain any kind of expense, the cost of the Iraq War is substantially small. So in an economic sense, we can afford the war. The war doesn't threaten the nation with bankruptcy, but it does divert substantial resources that we could use for human needs instead of for killing and destruction. Some will also say that the war is adding to the nation's debt, but this is relatively unimportant. So long as we do not go into bankruptcy, how we finance the war may help obscure the real costs. People may not be aware of the costs if it were paid for through current taxation. But there's nothing intrinsically wrong with government being in debt. In fact, to insist that government budgets always be in balance would be an extremely unwise economic policy. If people want to talk about that, we can talk about that in the discussion, but all economists recognize that it would be an unwise economic policy for the government to always keep its budget in balance. What should concern us is what the debt is for. If the federal government were to go into debt to provide quality education to every child in the United States, provide health care to every child, to every person in the United States, this would be a good investment. It would be like borrowing money to fix the leaking roof on a house. In contrast, the current expenditures for the war, in addition to financing needless killing and destruction, do nothing to make us better off in the future. If the war is a burden on future generations, it will be principally because future generations will be burdened by the destruction we've caused, as well as by our failure to finance human needs in the present.
Thank you, Bob. I think that really helped to understand the tough choices that we need to make when it comes to the budget. Our next speaker tonight will be Joe Miller, one of the national coordinators for Vietnam Veterans Against the War. And Joe will talk about the social costs for veterans who've been hurt psychologically and physically, and contextualize veterans' health care within the total cost of war making. Welcome, Joe.
I should let it just stop at that introduction. That pretty much says all I feel I can say. My approach to these issues comes out of obviously being a veteran and knowing people who had to deal with the veterans' healthcare system such as it is, and recognizing over some 40 years of political and social activism what war means and how in this country people tend to think that we can fight wars on the cheap. Because and these days, particularly since we've got the all-volunteer service, there's a tendency for people not to even connect with people who are in the military and people who are coming home. I just want to read you a short section of a piece that probably most of you know about from General Smedley Butler, who was one of the most decorated Marines who left the Marine Corps in the early 1930s, participated in the bonus marches in 1932, he wrote a small pamphlet called War is a Racket. And this kind of sets the framework for what I'd like to talk about. War is a racket, it always has been. It is possibly the oldest, easily the most profitable, surely the most vicious. It is the only one international in scope. It is the only one in which profits are reckoned in dollars and losses in lives. A racket is best described, I believe, as something that is not what it seems to the majority of the people. Only a small inside group knows what it is about. It is conducted for the benefit of the very few at the expense of the very many. Out of a war, a few people make huge fortunes. And he goes on to describe his role in that process while he was in the Marine Corps. People probably have seen the issue of Newsweek magazine, which talked about the wounded in the war, and presented some of the figures that Linda Vilmes has provided in her work on the end results of this war. Every war, the government tries to minimize the financial cost and tries to, in the end, undercut the services that are provided to the veterans afterward. The GI Bill that came out of the war my dad participated in, he's a vet, still alive from Battle of the Bulge. They got the GI Bill, which is probably the last major government program that gave a lot of solid benefits to veterans. Ever since then, wars have been fought and troops have had to come home to lesser benefits. Those of us who went through Vietnam had to deal with benefit struggles consistently. Once we finally fought to get the war over and were successful in that regard, we in VVAW declared war on the VA because the VA was cutting benefits. The war's over. Obviously, we don't need the benefits. It's kind of the thinking that's coming out now. There's a sense that once this war is over, that's the end of the cost. So we declared war on the VA. There's actually a picture of back on the table back there of a demonstration that we held in 1976 when VVAW took over the Statue of Liberty for the second time. We took it over in 1971 and we took it over again in 1976. At that time it was about veterans' benefits, increasing benefits. And we've consistently fought that political battle along with other veterans groups, service organizations, to try to make people understand that if you're going to send people off to war, you're going to have to pay for it. You don't get to have them come home and get stuck off in military hospitals like Walter Reed with the horrible conditions that we've heard about recently, and in a VA system, the Department of Veterans Affairs system, that is constantly underfunded. A lot of money is spent in the VA, and the VA is considered by most observers to be a very solid healthcare system. Many people would use it as a model of a healthcare system. The issue is that it is constantly underfunded, and as a result of the underfunding, they've started to try to cut out the eligibility of veterans for access to that system. So there's a major issue now coming down the pike with increasing number of veterans coming home maimed, physically hurt for the rest of their lives, and they need access to this system. If they are going to get access to this system, you need to chop off some people who had access to the system early on. So they've set up an eligibility profile that you have to pass in order to get access to the system. The increase in costs, the longer backlogs of waiting for health care, there's some 400,000 backlog cases now in the VA system. And it takes anywhere from 6 months to a year for some of these cases to be dealt with. So while the system might be considered a great system once you're in it, the issue is getting into it and getting the health care that you deserve. The underfunding issue is a consistent struggle, and one of the things that's coming out now with the new Congress is that a lot of the veterans organizations are putting the Democrats' feet to the fire. The DAV, the Disabled American Veterans Association, came out with a press release recently basically telling the Democrats, okay, when you were out of power, you told us that if you were in power, you would increase veterans' benefits, increase the funding for the VA. Now it's time to do so. So now the Democrats are kind of under the gun, so to speak, on this issue, and are going to be pushing to try to increase the coverage for veterans treatment. Now, as is pointed out, if you're going to be increasing the fund for veterans treatment, that money is going to come from somewhere, and it's going to come from other programs. It's going to come from other healthcare programs, potentially. It's going to come from education. It's going to come from all of these issues that the Bush administration and other administrations in the past have constantly tried to cut. You don't take it out on the veterans, however. We as a nation, whether we supported the war or not, are responsible for the people who put on the uniform and went, and responsible for their care when they come home. Some, as Bob pointed out, probably for the rest of their lives. Some might be on short-term disability. Some might be on permanent disability. And permanent disability is a pretty expensive thing. That's a lot of money coming out of the budget. There's a coalition of veterans organizations that apparently over the past 21 years, I'd never noticed this until I started thinking about this topic. Over the past 21 years, they've been putting out what they call an independent budget for the Department of Veterans Affairs. It's a huge document. This is their take on what the Department of Veterans Affairs budget should look like. They want an increase of something like $2.5 billion over what the administration is asking for. They want the Veterans Affairs budget to be mandatory, no longer discretionary. The Veterans budget is discretionary funding. They want this to be mandatory. As long as we're going to be sending people off to war, we should require people to pay for it. Unfortunately, the issue of tax cuts and all of these kinds of things, these things are going to be popular for a lot of people, and that's going to mean that the money for any increase in funding for veterans is going to have to come from programs that we probably would rather support. But the veterans have paid a price, some in very extreme ways, some in psychological difficulties which may not hit them right away, but may not hit them for 10 and 20 years down the pike. They're going to be in that system. We can't pretend that once the war is over, the veterans' needs are going to end, as the current budget pretends. They're actually calling for a decrease in veterans funding beginning in 2008. And to go from 2008 to 2012 to decrease the funding for veterans health care. The reality is, as Linda Billings has pointed out, that this need is going to increase, and the eventual cost for veterans care is probably going to get up to around $700 billion for this war plus the past wars. There are people still around from past wars. So we need to think about that. We need to pay attention to what veterans' needs are, and when we're thinking about how the budget affects us, whether we have somebody in the military or not, we need to make sure that we keep the promise that's made to these veterans when they put on the uniform. Thank you.
Thank you, Joe. I've learned a lot from your speech as well, and there's a very interesting idea for making veterans health care mandatory as opposed to discretionary. I'll be the next speaker this evening. As I said, my name is Katie Coombs, and I'm a community organizer at Champaign County Healthcare Consumers. Tonight, I'd like to take some time to talk about the impact of the war costs on funding for healthcare programs in the federal budget. As we've already heard, the President's 2008 proposed budget includes cuts to vital healthcare programs while we continue to find funds for the war. Priorities reflected in that decision are out of line with the priorities of most people. While we know that the President's budget is just the first step in the budget process, and Congress will make the decisions to finalize the budget for our country, it's important for us to understand what is at stake so we can take action and make our voices heard about what's important to us. Healthcare is the major concern and what's most important to Champaign County healthcare consumers, and we do not accept the President's proposed cuts to healthcare programs, especially in light of his proposed increases to war funding. The President's proposal puts politics before people and fails to make the responsible choices necessary to maintain affordable health coverage for millions of Americans. The healthcare programs that will be most affected by the proposed cuts are Medicare, Medicaid, and the State Children's Health Insurance Program, which is commonly referred to as SCHIP. The people enrolled in these programs are our most vulnerable Americans. They are senior citizens, people with disabilities, and children. I think it's important to take a few minutes to really consider who these people are that will be impacted by the President's proposed cuts, and would like to cite some facts assembled by Karen Davenport from the Center for American Progress. Medicare provides health insurance to 43 million Americans, including more than 6 million people with disabilities and 5 million people over the age of 85. 50% of the people with Medicare have annual incomes below $20,000, and 9 out of 10 have a chronic disease. People with Medicare face rising premium and co-payment costs as the cost of healthcare in our country rises, but they have been guaranteed a basic level of economic security through the Medicare program. Across the nation, more than 47 million Americans cope without healthcare coverage and know that they're one serious illness away from financial disaster. As healthcare costs have skyrocketed, employer-based coverage has eroded, and the cost of private insurance has spiraled out of reach, many families and children have turned to Medicaid and the S-CHIP program. Since 2000, 6.8 million people have lost their healthcare coverage, but S-CHIP and Medicaid have ensured that the proportion of low-income children without health insurance actually declined during this period from 20 to 14%. The President's budget proposal includes significant cuts to these already underfunded programs. The Medicare and Medicaid programs will be cut by $102 billion over the next 5 years. And this cut is paired with a proposed increase in the Part D premiums for some Medicare beneficiaries. Medicare Part D is the new prescription drug benefit that the Bush administration added to Medicare at an approximate annual cost of $40 billion. This new program is widely criticized by Medicare beneficiaries, healthcare advocates, and national economists for its failure to save Medicare beneficiaries money on their prescription drugs, due to the fact that it's run through numerous private insurance companies and not Medicare. It would seem that the President is willing to find funds for healthcare like this $40 billion for the Part D program when it benefits big business, but not when the federal healthcare funding is going to go directly to helping needy people. The President's proposal to cut funding across the board for Medicare and Medicaid is nothing short of reckless as the American population ages and more working families are without health insurance. Healthcare costs do need to be reined in, but not on the backs of patients. Savings in healthcare costs can be found in other ways. For example, savings can be found in Medicare by allowing Medicare to negotiate discounted drug prices and creating a single Medicare-administered drug benefit. The funds can be found for the Iraq War, so I know that they can be found to fund these vital healthcare programs. We simply need the will and leadership to do so. The President's proposed budget also includes significant changes to the S-CHIP program. While the proposed budget would reauthorize the program for the upcoming 5 years, it provides less than half the funding necessary needed for states to maintain their existing S-CHIP caseloads, let alone make progress in covering more uninsured low-income children. Under the President's budget, the Center on Budget and Policy Priorities estimates that the states would experience a total federal funding shortfall of $7 billion over the next 5 years, and a total S-CHIP enrollment would decline by 1.6 million people. The S-CHIP program clearly needs to be fully funded, and it requires additional funds to expand so that all children and their families have access to affordable health insurance. In Illinois, the S-CHIP program is called Kid Care and Family Care. You might be more familiar with those terms. And Governor Blagojevich has touted that the S-CHIP program has allowed more than 290,000 children and their working parents to get access to health care in Illinois. The demonstrated successes of S-CHIP in effectively moving children and families out of the uninsured status must not be ignored. Lack of insurance and therefore lack of access to affordable health care services is one of our major domestic issues. We can move forward and extend affordable health insurance to more children by authorizing additional S-CHIP funding for the next 5 years. Experts estimate that approximately $50 billion is needed in additional S-CHIP funding to cover all the children in America. As a healthcare advocate, $50 billion, it sounds like a bargain. You can't put a price on access to healthcare. But unfortunately, you have to in the budget process. So let's compare the cost of fully funding S-CHIP and the $50 billion increase. It would be a $10 billion increase a year for expanding the S-CHIP program. In terms of war costs, that $10 billion is just 0.3% of all projected U.S. spending for 2008. And remember, we learned earlier that 51% of our spending is going towards military costs. So it seems relatively inexpensive. To put it even more simply, the total $10 billion needed for the entire year to provide health insurance to all children is less than what the U.S. pays for the war in Iraq in any given month. So it seems like we should be able to do this. In Illinois, the president's proposed budget would reduce the number of children who have affordable health insurance currently through SCHIP and deny the nearly 400,000 children who currently lack coverage the opportunity to obtain health insurance through the proposed SCHIP expansion. More information about how the president's proposed budget would impact Illinois residents is available in the report First Things First for Illinois, issued by the Coalition for Human Needs and the Emergency Campaign for America's Priorities. And if you're interested, copies of the report are available at the Healthcare Consumers table. And currently in Illinois, we're launching the new program, All Illinoisans, to improve people's access to healthcare services. We've also helped to fill gaps in the Medicare Part D program with the Illinois Cares RX program. So if a state can tackle these tough healthcare issues, I'm sure the federal government has the resources to do so as well. Tonight we've learned that as a nation, we do have the resources needed to fund domestic priorities like healthcare if we're willing to make the tough choices. We just need the will and the leadership to do so. During the congressional budget process, priorities need to be set and decisions will be made that affect our daily lives today and for years to come. Funding for healthcare is an investment in the health of our citizens and the future of our country. And we cannot allow the cost of the war to become an excuse for not funding vital healthcare programs for our most vulnerable citizens. Medicare, Medicaid, and SCHIP funding should not be cut and needs to be increased to serve the needs of all Americans who are eligible. And So the next thing on the agenda is some time for questions and answers. And we have the room kind of set up in ways that folks can see each other. So I think that if people can manage to do it in an organized way, I'll step to the side and sit at my seat. I think that our speakers, Bob and Joe, are more than willing to take questions. So I'll see how it works. If it doesn't work out, I'll step back up here and kind of moderate it. But we'll see. Does anyone have a question or a comment to discuss anything? Yes.
Well, I'll take up Bob on his thing about the balanced budget. So you said that most economists agree that a balanced budget is not desirable or necessary. Can you explain?
Yeah. So the reason is this. In the economy in which we live, there is some kind of cycle, right? I mean, it's always the case that some people are unemployed. It's always the case that not all the resources in the economy are being used. There's some kind of cycle. So suppose that you would decree that from now on there's always going to be a balanced budget. The government's expenditures have to absolutely and always match its revenues. What this would mean is that when the economy is in a downturn, the government would be forced to raise taxes because when the economy is in a downturn, it's always going to be the case that there's pressure for expenditures to rise, revenues will fall. If people who are now employed are thrown out of work, on the one hand, they're not paying taxes on the income that they would get from their wages. On the other hand, some people will be unemployed or more people will be on welfare, so the government's expenditures would rise. If government can't engage in deficit spending in that situation, then they would have to raise taxes even more on the people now working in order to compensate the fact that some people aren't paying taxes and the additional expenditures and the people now unemployed are on welfare. By sucking money out of the economy to do that, then they would further depress the economy, worsening the recession. So that's why every honest economist would agree that it would be insane for the government always to balance its budget.
Unless you plan for those periods. so that a portion of the federal budget would always be set aside for those periods where there were economic downturns.
No, it doesn't matter, because it's still the case that.
Because you were saying that it would only be the case if your outlays must meet the revenue. But if a portion of your revenue is always set aside to meet the unforeseen needs of future downturns in the economy.
Well, okay, think of it this way. Suppose you were to do that. Suppose you were to take money, suppose the economy's in boom, and you say, and the government say, okay, well, it's not always going to be in boom, so we're going to take a bunch of money and we're going to stick it under a pillow somewhere, and then we'll bring it back when the economy's in a recession. You could do that, but it would be a tremendous waste, because you can, instead of sticking that money under the pillow, you could use it for something useful. And since there's absolutely no harm to the government engaging in deficit spending, why would you do that? There's just no reason to do it at all.
Well, that was kind of the point of the Clinton years, which touted the not only the budget being put back into balance, but there was a huge surplus when Clinton left office. And it was within a couple of years after Clinton left office that we found ourselves on the opposite end of that stick. So that that's essentially what happened, was that we had a huge surplus that was set aside, and we've spent it all on what most of the people in this room would consider to be a waste.
Yeah, so the key part is the waste. That's the issue. It is true that during the Clinton administration, there was a lot of talk about balancing the budget. It should be pointed out that the surplus was, in terms of current revenues and expenditures, the government was still in debt. But in terms of the inflow and outflow, they reversed the deficit spending. But the important thing about this, and why I mentioned this in my talk, is that the Clinton administration officials misinformed the public at the time by speaking about the deficit as if it's this tremendous threat to the republic. And because this was being said by Democrats, this really confused a lot of people who otherwise would have been misinformed. So it would not have been misinformed. And so all the more reason that people should speak the truth about this and not contribute to this notion that there's something intrinsically harmful about the government running a deficit. We would have to do a certain amount of education to counteract the misinformation that existed before 1992 or before 1991, when Clinton, as people started saying that, and then we have to do an additional corrective level of education to compensate for all the misinformation that happened during the Clinton administration between 1992 and 2000.
I got a question for Mr. Miller. How has the Veterans Administration and their related agencies been in providing jobs and hiring veterans and disabled veterans to work within the VA system?
From what I've read, from their own information, says that they're one of the top employers of veterans and as well as disabled veterans in cases that they might be necessary. So that they in terms of internal hiring or in terms of helping them get jobs outside.
Well, the first one is internal.
Internally,
running the paperwork and the bureaucracy,
right.
and then the hospital care and what have you.
Right, and they do a fairly, at least from their own reports, they do a fairly good job of bringing veterans into that system. And it makes sense because veterans helping veterans is a way to run that. One of the things that happens very often, though, is there are only so many jobs to go around, right? And if it becomes part of the overhead for the budget of the Veterans Affairs Administration, then doesn't that take away from potential assistance that might be given more money that might be given to healthcare. I'm not saying that these people should be unemployed, but the question is, if you've got a budget that is already based on discretionary expenditure, and you've got to employ these people and pay these people, that becomes part of the issue for the overall cost of the Veterans Affairs Administration. And when you've got more people coming home, like I say, with pretty substantial injuries, their costs should take some higher priority, I think.
Well, does your organization yourself, do you accept the premise that we're not going to raise taxes and that this has to be a situation of taking from other programs?
No, we
The
don't.
war is a new program.
Yeah.
It should have had new funding.
No.
It would
Vietnam
be
Veterans
quite
Against-
logical to me.
Vietnam Veterans Against the War says if you're going to go to war, you're going to pay for it.
Right,
And
nobody wants
you
to-
don't pay for it on the backs of poor people and people who already need health care.
Right.
So the tax cut issue, the tax cuts should not be reinstated. The tax cuts should be allowed to disappear. And people who are making, as I made quite clear in that quote from General Butler, the people who are making a lot of money off of this war should be paying for it.
Yeah, basically, that whole discretionary part of the budget should be up in arms over what's happening, because it's not just the veterans and the healthcare, it's the national parks and
Sure.
the EPA and
Right.
the whole finality. There's
While people are making billions of
a lot
dollars
of people
in
are
profit.
making billions of dollars, all the rest of it.
Right.
I think it's probably a wrong tactic or strategy to think that we have to be taking from one to finance the other. And politicians seem to be blackmailed into not raising taxes, or saying they won't raise taxes because they're all afraid of not getting elected.
That's
So there has to be a quid pro quo there.
well, part of what we would hope in terms of the veterans organization that I work with and other vets groups that we work with would be that if we are vocal enough about this, that maybe we can give these politicians some backbone to actually and lay the truth out for people. If you're going to go to war, part of the cost of the war needs to be covered, and I'm not saying that the middle class needs to pay the price, because they tend to pay the price most often anyhow. I think it's important for people to understand that there should be no war profiteering. War should not be a profitable experience for these people. They should have to pay for this, because they're the ones making the big bucks. And I have no hesitation in saying that any profit margin that these people get, these corporations or whatever get out of war, should automatically go back into the treasury. Should be no issue.
First off, I want to say thanks, because this is great, and I wish everyone could hear these arguments. I think it's really good. I just have a nagging concern that I hope someone can address. And that concern is that the people in the administration right now don't think like what you've said, and actually kind of follow the Reagan era of starve the beast, right? So in fact, as some have argued for Reagan, perhaps the goal is to cut other programs and to get rid of these programs. And again, it's really hard to imagine and to fathom that people don't want these programs, but can someone just assuage this fear?
It's not that hard to imagine.
It's so good.
Well, let me just toss in one quick thing, because just in relation to veterans healthcare. One of the things that we've seen over recent years is a fairly consistent effort in privatizing veterans healthcare. And so that just goes along with the whole rest of the program. That they want to turn everything over to private interests and not have any public responsibility or public accountability for this program.
Yeah, I agree with what Joe said, and let me also add that these formulations, these shibboleths, are much less stable and powerful than people sometimes imagine. Like the tax question, Reagan raised taxes, Bush raised taxes, Clinton raised taxes. There's a certain group of predominantly Republicans who will say, no new taxes, no new taxes, but then we'll raise taxes. And the same thing happens on the spending side. After all, Katie mentioned the $40 billion for the Medicare Part D. That was a substantial increase in added government benefit and added government expenditure. I mean, we don't agree with the way that they did it. Obviously, they're tremendously wasteful, and the sop to the pharmaceutical industry of not allowing Medicare to negotiate, as the VA is allowed to. The VA has a formula, right? So there's, of course, no, I mean, it's just pure corporate welfare, which hopefully the Democrats will reverse, as they've promised to do. But that was a major expansion of government benefit. Why did that happen? Well, they wanted to win the next election, and there were a lot of people in the Republican Party that didn't want to go along with that, and the Republican leadership said, you have to go along with this because we need it, because we're about to run an election. So so these things are because we still live in a democracy, and there are elections every 2 years. These things can be defeated if there is a clamor for them. With the S-chip, it's the same dynamic. And it's just overwhelming, and of course, there's overwhelming support for universal health care, but in particular for covering children, there's overwhelming public support, and that's why this program has been implemented, even, and this is before the last election, even in a climate of unitary Republican control, we have this program. So, shake the tree more stuff will come there.
I want to make a brief point about the so-called Clinton surplus, and that is that the budget was balanced primarily in the last couple of years of his term on the backs of the poor by so-called welfare reform and by depriving people of, the least local and so that this took away for his political benefit, which really didn't. It allowed the next administration to advocate different uses for that so-called balanced budget.
Yeah, well, if you want me to respond to that, I would say that the Clinton thing that Clinton did with the welfare reform was a terrible thing. But as a percentage of the budget, AFDC, the program that was abolished, aid to family with expenditure, was extremely tiny. That's not how they balanced the budget. It was mainly tax increases and some expenditure got a small amount of money. Clinton did that for a political reason, so he could, be Mr. Tough Guy. And also, it wasn't zeroed out. They replaced it with another program, temporary assistance to needy families. So it's not like they got all the money back. Part of the fall in welfare expenditures during the Clinton administration was due to the fact that the economy was expanding, and that brought more people into the labor force. So, but I totally agree that was a terrible thing that Clinton did, and Clinton and Congress did. But it's not a big. It wasn't a big contribution to balancing the budget. But the larger point, during the period when Clinton was piling up these surpluses, there were human needs in the United States not being met. Not just AFDC, but obviously, still didn't have universal health insurance. Still don't have quality education for every child in the United States. And these are choices that we're making now that our country will pay for years into the future, because some of these things obviously can't be reversed in the future. The failure to provide adequate health care and education for children now is a cost our society will pay for years into the future.
Let me add one thing to that. Another thing that I discovered as I was reading over for material for this evening, which I missed at the time. In 1996, the Veterans Health Care Reform Act was passed, which basically required the Department of Veterans Affairs to reconstruct its access programs to make sure that certain groups of veterans would not have access to health care, or make it more difficult for them to get into health care. So part of what we're dealing with today is, comes out of that period too.
I was just gonna ask, and I don't know, maybe this goes back to her point of not wanting to have certain programs exist anymore, but, if it's okay, if it's recognized that it's okay to go into debt, and is there a reason that, a certain administration wouldn't just go into debt a little bit more and fund, programs like S-CHIP and the things that are working out well a little more and still fund the war at the same level? I mean, I don't know, why can't we just borrow more? I don't know, I mean,
So there's,
or I don't know.
yeah, no, it's an excellent question. I mean, one thing that we can, so in terms of the, kind of the recent politics in the United States, I think kind of a key thing to take away from this discussion is that this completely artificial situation has been created where the political discussion is, on the one hand, if we're talking about the military, then, look, there's no limit. But if we're talking about, healthcare and education, all of a sudden we're poor. And the people around Clinton contributed significantly to the situation that we now have to reverse. And this is a really good time to have this discussion because, the Democrats are in power in Congress with a narrow majority. We're now in the presidential campaign season of 2008. Maybe there'll be a Democratic president, and that battle's going on now, so we could reverse this horrible thing that Clinton did in helping to sort of entrench this idea that the government can engage in deficit spending. For the war, for the Iraq war, it's like, oh, there's no money, and then all of a sudden there's all this money through the supplemental process. And in fact, although this isn't really being talked about so much, the Democrats in Congress are sort of already doing this on their strategy on the supplemental, because the supplemental it's outside the normal budget process, right? So it's not subject to the ordinary rules that Congress has imposed as a legacy of the Reagan-Clinton era. That if you fund one thing, then you have to cut something else. You have to raise taxes. So in fact, in the current, Bush asked for $100 billion. Congress is about to approve $125 billion. Because, stores open. And so they're increasing funding for veterans health care. They're putting in money for S-CHIP. They're putting in money for Hurricane Katrina reconstructions, all kinds of farm relief, all kinds of good stuff. And, a lot of bad stuff, but anyway, and there's a lot of good stuff that the Democrats have put in the budget, and kind of like, daring Bush to veto it, and say, oh, no, like Bush is going to veto the supplemental for the war because it has more money for S-CHIP. He's not going to do it. So in fact, in some measure, Congress is already answering your question. It's like, okay, oh, it turns out that we can do deficit spending after all. Wonderful. Let's spend some more money on New Orleans. Let's spend some more money on kids.
Okay, well, that was some great discussion. So the last thing on the agenda tonight is to talk a little bit more about how we can be involved in the congressional budget process as citizens. We talked about how important the congressional budget process is tonight. And while Congress is the one that's actually going to be writing this and making the votes, they do so on our behalf. And the senators and representatives in Congress are charged with representing the interests and wishes of their constituents. And in order for them to represent us, we have to tell them, what we think and what we want. We have to share our expectations and priorities for the federal budget. And we have to let them know we don't find it acceptable to cut costs for health care and education and veterans programs while they continue to find funds for the war, or just in general, we don't support cuts to those domestic programs. The last page in the packet that you have is blue, and it has some information about how to contact our representatives in Congress. It's double-sided, so the first page that you see that's facing up talks about an important vote next week about the supplemental funding for the 2007 budget. And included in this supplemental funding bill, there is an allocation for additional SCHIP funding for the shortfalls we know that states are going to be experiencing this year. And it would include more than $200 million in SCHIP funding for Illinois. So we really encourage people that care about this to contact Representative Johnson and let him know that we support this supplemental funding for SCHIP and we support the supplemental funding bill in the House. This bill does include language that calls for troop withdrawal in Iraq, so we know that Representative Johnson is going to be very heavily pressured on both sides of the aisle to vote in different ways. So we really need to make our voices heard to Representative Johnson before this vote next Thursday. He did vote a couple weeks ago in favor of a unbinding resolution to reprimand the president for requesting additional troops. So I think that even though we do have concerns about where people's interests lie, I think that there's been a history that he responds well to constituents' input, and we should take note of that and be sure to make our voices heard before the vote next week. The opposite side of the blue sheet has the contact information for all of our representatives in Congress, both senators and Representative Johnson. Because the budget process is long and complicated, there's going to be many times in the coming months where we need to take action and contact our elected officials in Congress and encourage them to support a 2008 budget that's in line with America's priorities. So I hope that you find those 2 pages really useful in the coming months. And thank you, everyone, for coming here today. I want to thank our speakers, Aurora, Joe, and Bob, and our co-sponsors. And our co-sponsors tonight, Just Foreign Policy, the Illinois Disciples Foundation, Progressive Resource Action Collaborative, and Activist Forum. Events like this are being held across the country to educate citizens about the budget process, to discuss what's at stake in terms of our priorities and federal programs, and learn how we can participate in the budget process. So I hope that everyone here today takes time to contact their representatives about the budget priorities that you hold in your heart. I want to make 2 announcements, and if there's others, we can take time for those. At the table in the back, Champaign County Healthcare Consumers has some petitions about supporting Medicare Part D reform and local healthcare access being increased. We also have some information, Joe pointed out some nice photos and different information, so check out our table. And then Aware has a table. They have a postcard campaign going. You're welcome to take a postcard and sign it tonight. And if anyone else has announcements, I turn the floor over for that.
One other thing that's I'm sorry, go ahead.
I got a quick question. You've only got phone numbers here. I assume that's because this is on a short time frame.
Yes.
But realistically, what's the thought of some of you who've been dealing with the legislative issues on phone calls versus emails versus real letters? Like 30 years ago, activists concentrated on letters because a letter was something you had to spend a lot of time on. It cost you a stamp and effort. A phone call was, okay, somebody's out there corralling people. What's considered most effective today?
I think a phone call is probably most effective because of the problems with the mail and the security related to it. If you send it to the local office, it'll have more of an impact. Letters in Washington can take 6 months to be opened, so I would not really recommend sending a letter to Washington, unfortunately. If you're going to write a letter, I would put it to the local office. It does take longer than you would think for them to get it even at a local office. So a phone call, they take a message immediately. They aren't usually that busy in terms of getting phone calls on legislation. So even if you get 10 phone calls in, they consider that each phone call represents at least 3 other people that didn't take the time to call. So we would encourage phone calls to the local offices, and then emails really don't seem to make that much of an impact. I mean, if that's all you can do, we would encourage you to do anything. But phone calls seem to be where we've noticed we get a good reaction. And going in person also, I mean, if you really have the time and we're going to spend it on writing a letter, you can go in person and hand deliver it, and that would definitely make an impact.
You could go over to Lincoln Square and walk along beside Representative Johnson and have a personal conversation.
So, yeah.
Almost every day. Good time. In the morning. 10, 12.
So there's different different ways to be creative, but yeah, the mail system is kind of been slowed down, so it's not quite as effective. And
I just wanted to point out, we've got a few copies. In 2005, Vietnam Veterans Against the War and Iraq Veterans Against the War combined to work on a short report on the healthcare system for veterans, and there's a few copies of that report on the table back there if you want to read that out.
great. All right, well, thanks everyone again for coming out.
Jim says 30, Jim says 28.
I estimated 30 is 28.
Thanks for asking questions. That's the most scary part.
Here, all of us.
This is a great event. Well, it's so hard to,